Good morning. This is Dr. DEEPTI, Senior Lecturer, Department of Conservative Dentistry and Endodontics, Shri Balaji Dental College and Hospital. I will be presenting on zinc oxide eugenol. Zinc oxide eugenol cement has been used in dentistry since the 1890s. They are the cements of low strength. They are known to have obtrusion effect on the exposed dentin. The ADA specification for zinc oxide eugenol is number 30. Zinc oxide eugenol is used as an temporary luting and as an temporary restorative material. So here you can see a zinc oxide eugenol temporary restoration in a root canal treated 6. Coming to the classification. The zinc oxide eugenol are classified into 4 types depending upon their use. They are classified as a temporary luting or cementation, type 2 as permanent cementation, type 3 as filling materials and bases, and type 4 as cavity liners. Zinc oxide eugenol, they are available as a powder liquid as well as in paste form. Mostly zinc oxide eugenol is used in its powder and in its liquid form. So coming to the composition, powder, the main ingredient of the powder is zinc oxide, which is 69%. The other ingredients are white rosin, zinc stearate, zinc acetate, and magnesium oxide. White rosin, 29.3% is added to reduce brittleness of the set cement. Zinc stearate 1% acts as an accelerator and a plasticizer. Zinc acetate 0.7% acts as an accelerator and it improves strength. And magnesium oxide is also added in some powder. Coming to the liquid, the main component of the liquid is eugenol, which is 85%, and then olive oil 15%, which acts as a plasticizer. Manipulation. The powder liquid ratio is 4:1 to 6:1. 4:1 is for luting and 6:1 for restoration. The mixing is done in a clean glass slab with a stiff stainless steel spatula. So for the powder liquid ratio for zinc oxide eugenol is used as a temporary luting and as a temporary restorative material. For luting, the powder liquid ratio is 4:1. The desired quantity of powder is taken. It depends upon the number of provisional crowns which we are going to use, and a small amount of liquid is taken. The bulk of the powder is incorporated into the liquid. The cement is mixed in a circular motion. The final luting consistency will be like this. It will be like a creamy consistency. It will be like this. It should not be runny, but the luting consistency should be like this. It should be creamy. The luting in zinc oxide eugenol, you won't get the string formation like an zinc polycarboxylate or like a glass ionomer cement. You won't get any string formation in luting consistency of zinc oxide eugenol. For the adequate amount of powder is taken. The amount of powder needed depends upon the size of the cavity. The powder is divided into 2 big halves, and the second half is divided into 2 smaller halves. The first big half is incorporated into the liquid and it is mixed in a circular motion, followed by the incorporation of other 2 smaller halves one by one. The powder is mixed with a liquid using the stiff stainless steel spatula by applying light pressure in circular motion. The final restorative consistency should be like this. It should be a dough-like consistency. You can roll the zinc oxide eugenol on the glass slab. The powder will not stick to the glass slab. So this is this picture you can see here. This is the luting consistency and this is the restorative consistency. The luting consistency is cream consistency, whereas the restorative consistency is a dough-like consistency and it will not stick to the glass slab. Coming to the setting reaction, The second reaction of zinc oxide eugenol takes place in two steps. First is the hydrolysis of zinc oxide to zinc hydroxide, and the second is zinc hydroxide reacts with the eugenol to form a zinc eugenolate and water. So where does this water come from? So the water is essential for the reaction to proceed. So where does this water come from? The powder which is supplied, the oxide powder which is in use for dentistry is not anhydrous. That means it is not without water. The powder has 2% water. The 2% water is used for accelerating the reaction. The zinc oxide combines with this 2% water to form zinc hydroxide. The zinc hydroxide reacts with eugenol to form zinc eugenolate and water. The reaction is autocatalytic. This water again reacts with zinc oxide to form zinc hydroxide. The zinc eugenolate, which is formed, initially it is an amorphous gel, which later it tends to crystallize. So the structure of the final set cement consists of unreacted zinc oxide embedded in a matrix of zinc eugenolate. So this is then the scanning electron microscopic image of the set cement of zinc oxide eugenol. Here you can see zinc oxide powder particles. They are held together by the zinc eugenolate matrix. Coming to the physical properties, the zinc oxide eugenol is relatively a weak cement. The compressive strength or compression strength is the capacity of a material or a structure to withstand loads tending to reduce its size. The compressive strength of zinc oxide eugenol is 6 megapascal to 35 megapascals. If you compare the compressive strength with an glass ionomer cement, with amalgam or with composite, you can see the compressive strength is much lower, is very much low compared to all other restorative materials. So it has a very low compressive strength compared to all the other restorative materials. Now coming to tensile strength. So first, what is a tensile stress? Tensile stress is the force that tends to stretch or elongate a body. Tensile strength is the maximum load that a material can support without fracture when being stretched. So the tensile strength of zinc oxide eugenol is 0.32 to 5.2 megapascal. If we compare it with dental amalgam, with composite or a glass ionomer cement, it is very low. So the tensile strength is also of zinc oxide eugenol is also low compared to the other restorative, permanent restorative material. Then coming to the modulus of elasticity. The elastic modulus is a quantity that measure an object or a substance resistant to being deformed elastically when a stress is applied to it. The modulus of elasticity for zinc oxide eugenol is 0.03 pounds per square inch. Coming to the coefficient of thermal expansion. Coefficient of thermal expansion describes how the size of an object changes with the change in temperature. See, if there is an increase in temperature, that could be volume expansion. If there is decrease in temperature, there could be volume contraction. The coefficient of thermal expansion for zinc oxide eugenol is 35 to 10 to the power of -5 degree Celsius. The coefficient of thermal expansion should be similar to the human teeth. Otherwise, it can that will be stress in the restoration tooth interface, which can that can lead to failure of bond at the restoration tooth interface. Which can lead to micro leakage, marginal staining, and the potential for secondary caries formation. So in this chart, you can see that the material the materials which are having coefficient of thermal expansion closest to the tooth are ceramic and glass ionomer cements. And the overall properties of zinc oxide eugenol tabulated here. The powder liquid ratio is 4:1 to 6:1. I have already mentioned about the compressive strength, the tensile strength. Solubility in water is 0.04 percentage. Film thickness for zinc oxide eugenol is 25 to 40 micrometer. Modulus of elasticity is 0.03 pounds per square inch. Setting time for a slow set zinc oxide eugenol, setting time is 24 hours. For a fast set, the setting time is 4 to 10 minutes. I have already told you about the coefficient of thermal expansion, which is 35 to 10 to the power minus 5 degrees Celsius. The coefficient of thermal conductivity is 3.98 at 10 to the power of minus 4 degrees Celsius per centimeter. Biological effects of zinc oxide eugenol. The set cement has a pH of 6.6 to 8.0. So zinc oxide eugenol is having a basic pH. The effect of zinc oxide eugenol on the pulp depends upon the concentration of the eugenol the pulp is exposed to. The zinc eugenolate matrix, this is having deep covalent bonds. So the zinc eugenolate can hydrolyze to form zinc oxide, zinc hydroxide, and eugenol. This free eugenol can move through the dentinal tubule. Through the dentinal tubules can reach the pulp. If the concentration of the zinc of if the pulp is exposed to a small concentration, the pulp is exposed only to a small concentration of this free eugenol, it is actually very helpful that the eugenol has sedative anti-inflammatory action as well as anti-bacterial property. However, at higher concentration, zinc oxide eugenol can be cytotoxic. Zinc oxide eugenol should not be placed in direct contact with the pulp. At higher concentration, as I told you, the zinc oxide eugenol can be cytotoxic. It irreversibly blocks the conduction of action potential in the nerve. It stimulates the release of superoxide from the neutrophils. It can cause increased tissue damage. So it can increase the free radicals, the release of free radicals from the neutrophil. This can cause increased tissue damage. Coming to the modifications of zinc oxide eugenol. Now, zinc oxide eugenol is modified to improve its physical properties. The first is resin modified zinc oxide eugenol. In resin modified zinc oxide eugenol, a resin is added to the powder. So, what resin is added? 20% of polymethyl methacrylate is added. In the conventional zinc oxide eugenol, the powder consists of zinc oxide, white rosin, zinc stearate, zinc acetate, and magnesium oxide. In a resin modified zinc oxide eugenol, instead of white rosin, 20% of polymethyl methacrylate is added. This polymethyl methacrylate increases strength, homogeneity, and smoothness of the mix, decreases flow, brittleness, and solubility. If we compare the compressives, the properties of resin modified zinc oxide eugenol, the conventional zinc oxide eugenol, you can see the compressive strength is higher compared to the conventional zinc oxide eugenol. The tensile strength is also higher compared to the conventional zinc oxide eugenol. See, the tensile strength for resin modified zinc oxide eugenol is only 600 pounds per square inch, whereas the resin oxide eugenol is 600 pounds per square inch, whereas the tensile strength for a normal zinc oxide eugenol is 300 pounds per square inch. And coefficient of thermal expansion is a bit higher, is higher in resin modified zinc oxide eugenol than conventional zinc oxide eugenol because of addition of polymethyl methacrylate to the powder. And coefficient of thermal conductivity is similar to the regular zinc oxide eugenol. The setting time for resin modified ZOE is 6 to 9 minutes. The pH after 24 hours is 6.8, which is basic. Film thickness is 32 micrometer. Modulus of elasticity is 0.39 pounds per square inch. Next, coming to the EVA modified zinc oxide eugenol cement. EVA is orthoethoxy benzoic acid. The orthoethoxy benzoic acid is a chelate which is used to improve the physical properties of zinc oxide eugenol. The EVA chelates with zinc to form zinc benzoate. So So in a normal zinc oxide eugenol, zinc reacts with eugenol to form a zinc eugenolate. In EVA modified cement, zinc reacts with EBA to form ethylene orthoetoxybenzoic acid to form a zinc benzoate. The EBA orthoetoxybenzoic acid is added to this liquid. In addition to adding EBA, fillers are also added to the powder. By adding fillers and resin, the solubility and the advantage of adding fillers and resin is the reduced solubility and the disintegration. The solubility and the disintegration is reduced by 1.2 percentage. The fillers which are added are quartz, fused quartz, alumina, dicalcium phosphate, lead oxide, mercuric oxide. This improves the mechanical properties. So coming to the composition of EBA modified zinc oxide eugenol, the liquid has 62.5% EBA and 37.5% eugenol. The powder can be powder. The filler in the powder can either be alumina 30% or fused quartz or calcium phosphate, which is 30%, and other constitute is zinc oxide. The advantage of adding EPA to the zinc oxide eugenol is that it increases the amount of powder incorporated to the liquid to obtain a mix of standard consistency. It increases the compressive, tensile, and shear strength. The EPA concentration, orthoetoxybenzoic concentration is less than 70%. Setting time is decreased. When EVA concentration is greater than 70%, then setting time is increased. EVA, it results in reduced solubility and disintegration. EVA has no adverse effect on the pulp. So if you compare the properties of orthoetoxybenzoic acid modified zinc oxide eugenol to conventional zinc oxide eugenol, again you can see the compressive strength is higher compared to the conventional zinc oxide eugenol. The tensile strength is also higher compared to the conventional zinc oxide eugenol. The coefficient of thermal expansion is higher due to the addition of fillers and has similar coefficient of thermal conductivity to conventional zinc oxide eugenol. Other than that, the second time is 7 to 10 minutes for EVA modified zinc oxide eugenol. The solubility in water is 0.05%. pH after 24 hours is 6.7. Film thickness is 25 micrometers. And modulus of elasticity is 0.79 pounds per square inch. Endodontic sealers. So what is a sealer? Sealer fills the gap between the gutta percha and the root canal wall. Zinc oxide eugenol can also be used as an endodontic sealer. There are three formula for ZOE endodontic sealer depending upon its composition. There are Ricketts formula, Grossman's formula, and therapeutic formula. Here you can see a sealer which is mixed on the glass plate with a stiff spatula. And here you can see gutta percha with sealer which is to be obturated. Now coming to Cavit. Cavit is a pre-mixed zinc oxide eugenol paste and it is used for temporary restoration and as cavity bases. Cavit is antibacterial. The composition of cavit is zinc oxide, zinc sulfate, potassium sulfate, glycol acetate, polyvinyl acetate, polyvinyl chloride acetate, triethanol amine, and red pigments. The second reaction is initiated by water and saliva. The zinc oxide reacts with zinc sulfate and the potassium sulfate to form a set mass. So here you can see cavit restoration, which is used as a temporary filling material in a root canal treated teeth. Its properties are linear setting expansion is 14.2%. Yeah. The compressive strength of cavit is similar to the conventional zinc oxide eugenol. pH after 24 hours is 6.9 to 7 and film thickness is 91 micrometer. The application and uses. Zinc oxide eugenol is used as a temporary restorative material, as a temporary luting material, as a liner or a paste, as a root canal sealer. It is also used as It's also used after periodontal surgery as a perio cap. It is used as an indirect pulp capping material. Advantages of zinc oxide eugenol are it is an slow setting cement, so it can be used as an root canal sealer. As a fast setting cement, it can be used as a periodontal. The slow setting cement can be used for a root canal sealer, whereas fast setting cement can be used for periodontal dressing. It has biocompatibility and obtrusion effect on the pulp. Obtrusion effect is pain relieving effect on the pulp. It can be used as a temporary filling material. It is radiophase. It has good sealing ability. It is used for the segmentation of provisional restoration. It is easy manipulation and cost effective. Disadvantages are poor mechanical property, high solubility, and unsuitable as a cavity base. Eugenol should never be placed as a base below the composite restoration because eugenol can inhibit the polymerization reaction in resin cements. Resin-based zinc oxide eugenol can have a shrinkage on setting. Resin modified zinc oxide eugenol can have shrinkage on setting, and zinc oxide eugenol is also found to have neurotoxic and the cytotoxic effect on high concentration. That's all about zinc oxide eugenol. Thank you.